Dr. Tony Milliano of Audiology and Hearing Center is our guest on this segment of Family Health Experts. And if you have a question regarding hearing aids, you're welcome to call in. 1-888-208-6946 is our phone number. And Dr. Tony, let me ask you this. In your business, you see these every day. What are the biggest changes you've seen in hearing devices just over the last couple of years?
You know, the changes have primarily become, in number one, they've miniaturized the devices to the point where they can be nearly invisible. And also they've developed a lot of technology that can do a lot of connecting to cell phones, connecting to TVs, connecting to all sorts of devices that will enhance your life, allow your ability to function and communicate more effectively.
Once you get those hearing aids, how often should you have a hearing test, or do you still need a hearing test?
Well, you certainly need a hearing test because hearing can progress and decline over time. You know, how often depends on your history. If you have a history of stable hearing, you know, once every couple of years is adequate. If you have a history of having a progressive hearing loss, then certainly more frequent than that, every year or even 6 months, depending on the condition.
Insurance is a common topic among everybody because medical care is not cheap. That includes hearing aids, and you know, you pretty well get what you pay for. But a lot of you out there may be wondering, does insurance cover these, or do they cover the loss of a hearing aid?
Well, there's a couple separate questions, and I'll address them separately. Insurances often do cover, you know, hearing aids. It depends on the individual policy as far as how much they'll cover. Some have, you know, a percentage, some have a dollar amount, some have, you know, a limit, some don't. So we call the insurance company on every single patient that we see to verify if or what benefits that they have. All hearing aids that are purchased new include loss and damage with the original manufacturer's warranty, and that can range anywhere from 1 year to 3 years or even more. If loss is a concern after that, then there are private companies that will offer loss and damage coverage.
One question that we do have, do I have to get hearing aids for both ears?
Well, that depends on your hearing loss. It is my common recommendation that unless there's a reason not to, then I generally recommend a hearing aid in each ear. For example, if a person has normal hearing in one ear, or maybe they have a dead ear on one side. But generally, research overwhelmingly supports that people hear better, understand more, and function at a higher level if they have a hearing aid in each ear.
One thing that we talked about before we got on today was the connection between hearing loss and dementia.
That's right.
And how closely is that related?
Well, there's some research that have come out recently from Johns Hopkins University and also from Duke University that have connected hearing loss, untreated hearing loss, with cognitive decline. And the research suggests that the cognitive decline is 2 to 3 times more prevalent in individuals with untreated hearing loss, and the disease can progress 3 to 5 times more rapidly.
One real quick question here is that if someone gets hearing aids and they don't feel like they're working, are they stuck with them?
Oh, absolutely not. Anything that we offer in our office, we have a 75-day trial. So anybody that has hearing problems, hearing aids that they're not satisfied with, please bring them back to your provider, regardless if that's myself or if you got them from somewhere else, because you really need to maximize that investment.
Dr. Tony Milliano of Audiology and Hearing Center has been our guest on this edition of Family Health Experts. If you would like more information, see our Family Health section on our web channel, WPSDLocal6.com. Once there, you can review this interview. Just click on the Family Health icon in the middle of the page.